Thanks, Erika, so much for joining us in Humanised Health Zoom room. Obviously, I'm BRCA. I'm a big fan of yours and all the work that you've done in the advocacy space around BRCA. So can you tell everyone for watching who you are and a little bit about your story?
Yeah, well, first off, thank you for the opportunity to sort of have this opportunity to talk about my advocacy and my journey with your followers. So my name is Erika Stallings. I am a music industry attorney based in the New York City area, and I'm also a freelance writer. My freelance writing really started when I was diagnosed with BRCA, which I'll talk about shortly. So really my experience with the BRCA starts with my mom. My mom was a two-time breast cancer survivor. She was diagnosed for the first time at the age of 28 back in 1993, before doctors knew that there were hereditary mutations that elevated your risk of breast cancer. And she had cancer for a second time when I was a senior in college. And that's when she underwent genetic testing and learned that she carries a BRCA2 mutation. And obviously as her daughter, I knew that I had a 50% chance of carrying it as well. So after I was about to start law school, and I always tell people law school is stressful enough without learning you have some type of hereditary cancer mutation. So I finished law school, I moved to New York, I started my career as an attorney. And then I underwent genetic counseling and testing in the summer of 2014 and learned that I had inherited my mom's mutation. And given my family history, the team that I used at NYU recommended that I have a preventative mastectomy before the end of the year. So I had a preventative double mastectomy in December 2014. But really, I think it's the lawyer in me. I love to read. I love to learn information. So when I was going through this experience, I was like, oh, I'm a Black woman, and my mom's Black, I'm Black, right? We know Black women in the United States have these really higher levels of mortality rates from breast cancer. I was like, I can't be the only Black woman who has a BRCA mutation. But I just didn't see a lot of other stories on the internet, which is what inspired me to write for the first time. I did a piece for Jezebel, kind of about my experience as a Black woman. Also as someone who was single, sort of planning for preventative surgery. And just the more research I started doing, I learned that a lot of other areas of health care in the United States, that there are racial disparities as it relates to who gets access to genetic counseling and testing, and how that connects to the fact that Black women get diagnosed at later stages, the fact that they're more likely to die from breast cancer. Currently, Black women in the US are 40% more likely to die from breast cancer than white women. So I don't know, I think a lot of times, I think a lot of people with BRCA mutations want to become activists, right? Because you're so galvanized by the experience. And I think for me, I was like, okay, I went through this experience and it was really hard. And what is going to be the lesson or the silver lining that I take from it? And so what I really took away from it was I need to sort of share my story and learn as much as I can, because I want other women who look like me to have that same opportunity to be able to lower their risk of breast and ovarian cancer.
Yeah, I definitely think, BRCA activism and advocacy has definitely got more popular since Angelina. But I'm a big believer in having a message, like having something that you commit your life to change. And obviously for you, given your own personal experience and that of the Black community, your message is loud and clear, health equality. It is very different based on the color of your skin, and especially in America, that's really, really apparent. What have you seen any changes, over the years since you started your advocacy work? I think we're seeing a really big, profound moment kind of in the conversation, but has it transpired into health?
Yeah, I mean, so I will say a couple of things, right? So for a few years, I've worked with the Barter Center for BRCA, which is a research center at the University of Pennsylvania. All of their research is focused on BRCA. And so last month, I partnered with them. We're launching a new initiative, Black and BRCA. And the goal is really to provide tailored educational resources and support, to Black families, to Black individuals, right? To first, I think, just educate people about genetic counseling and testing, and then for people who do learn that they carry a BRCA mutation, providing resources and support. I will say, since the beginning of the summer, I've had a lot of people reach out to me, which I think is a positive. I'm like happy that people are thinking about how do you tackle this issue. I think in terms of if I've seen progress, I think particularly early on when I was like new to writing and, being an activist, I was like, I don't really know what this means. And I think it's really easy to get discouraged because you like want to make big impactful change. And like that's hard, particularly when you're talking about like healthcare inequalities. And so the way that I think of it is like every person I can reach, right? Because it's not, particularly when you're talking about BRCA, it's not just the individual, right? It can be their whole family. So when people reach out to me, to ask me about genetic counseling and testing, or people tell me, oh, I read a piece that you wrote, it motivated me to go at least have that conversation, to me, that does feel like progress. I had an op-ed in the New York Times, actually last October, about this. And because of that, I had all these, I had a couple of like Black families reach out to me to say, oh, I do have a family history of cancer, but I have no idea what genetic counseling is. Will you talk to me? Like I've talked to people from all over the country, kind of just about like demystifying the process. I'm going to be, I have to actually prepare the notes. I'm going to be giving a talk at the National Society of Genetic Counselors this year about diversity and inclusion in genetic counseling, which, I was really excited to be invited to do that because I think it's on people's minds. And one of the things I'm hoping to do, I think hopefully through the Black and BRCA initiative, is to start a support group. Because I think for a lot of Black women, they don't necessarily see themselves in awareness campaigns or in support groups, and really figuring out a way to bring people together. It's kind of an upside of the pandemic. You can do things, like you don't have to just be focused on New York. You can bring people together from around the country.
Around the world.
So, yeah, right, around the world, right? So, I think sometimes when they think about the problem, it's like this big, overwhelming problem. Like you have to educate people about genetic counseling. You have to give people access to genetic counselors. There's a shortage in the United States. You have to educate people about risk management. You have to help them communicate with their family members. So I just try to sort of figure out like what part I can play in that big sort of journey and try to focus on that.
Yeah, that's incredible. I think, when I started in BRCA, it's a long time ago. So my mum was tested about 20 years ago. So we were one of the first people to be tested in Australia. And it's taken me, decades to realize how very fortunate I am. And I guess that's from me traveling around the world, meeting incredible advocates like yourselves, and actually realizing how privileged I was. Just to live in Australia, to have access to free medical. If I'm very sick, I can access a doctor for free whenever I need to. Even though my challenges were a lot, dealing with multiple generations of cancer and my own risk, I was incredibly privileged. And it's just really interested me to read. I've read a lot of your articles, and that's why we reached out. Because I've just really realized the true new frontier of health is health equity. That really, in order to really shift patient outcomes, purely it has to be around health equity. Because I spoke to an oncologist and he said, we were talking about access to medicine, and he goes, is it access or is it equity? Because he goes, someone with money and privilege can access whatever they need. So it got me really thinking, have we got it all wrong? Are we focusing on things that, don't need to necessarily be the priority? We need to elevate everyone, irrespective of their skin color, to the levels of privilege that certain people have. It shouldn't be about your level of education, where you live, the color of your skin. And it feels really weird, even me talking about this, because I'm white, super privileged, live, in Australia in a really safe neighborhood. But I think it's something that we all have to talk about, because I really want to see, all these movements like Me Too and everything that's happening transpire into health. And I don't think it's got there yet. I think, it's very, I think like we really do have to push. How important is it for, I guess, white people to step back and allow the Black community to have a voice, and how do we support it? Like, how's the best way to support it? Do we stay silent? Do we raise our voices? I think that's kind of the confusing thing sometimes. How can we best support?
Yeah. Well, no, I'll say two things. It's interesting you talked about the privilege, because that was, for me, I'm cognizant that, I'm a Black woman in the United States, so I do face challenges, but, I'm an attorney. When I was going through my preventive, when I was getting the testing and I was prepping for surgery, I had great health insurance. I had a job that let me take as much time off as I needed. My best friend is a doctor. She's married to a cancer researcher. They were able to tell me all the right things to ask. And even finding the team that I used at NYU, like, came through a friend who was like, oh, I know the head of the high risk program, and she'll see you whenever you want to be seen, right? So I'm still cognizant of, like, I was operating with a level of privilege, and so how do I use that privilege to help other people? I think in terms of, sort of, I guess I'll call it allyship, which I think is the term that people use. I think a key thing is like kind of really taking a step back and like learning the issues, right? Which I think everyone has to do. Because, for example, so initially when they asked me to do this talk at the genetic counselors meeting, there was a concern that because I am high, what they call a high SES, right? I'm a lawyer, I make a decent income, that I wouldn't be able to speak to the challenges or barriers to genetic testing. And so the people who, we sort of had to explain, right? Like, for Black people in the US, you can have lots of money and you can have really high education. It doesn't necessarily mean you don't encounter challenges when you go in healthcare, right? And something that I was in a conversation with some others actually last week, is that normally, like, right, the more money you have, that generally is going to produce a better healthcare outcome. But for Black women, that's not necessarily the case, right? You still see high levels of mortality at higher class levels. When you particularly look at maternal mortality, Black women with like college degrees are as likely to die as like a white woman who hasn't graduated from high school, right? So I think people have to sort of like take a step back and be like, I want to be an ally. So I have to like really educate myself about the issue. And then I need to like listen to the people most impacted and ask them, like, what is actually the thing that you need the most? I think, in June and July this summer, people wanted to help, which is great. I don't care how people get galvanized around the issue. If you want to help, I think that's great. If you want to be an ally, I think that's great. But there are sometimes I'd be in meetings and I feel like people would like talk over me. And I'm like, well, you're asking me my opinion and what I think, which means you actually have to just be quiet and listen to what I say. So I think it's a lot of that. I think it's the education, it's like the education piece. And then I think it's asking people what they need. Because I think sometimes people have such limited imaginations about what would be of benefit to Black women or Black communities. And I think people would be really surprised by what people need. And I also think there's a tendency, I saw this actually a lot like at my former employer, right? People were like, oh, there's all these problems in society. I want to wake up. I want to fix everything. You can't fix everything. You kind of have to like fix the thing. You have to pick your thing and really educate yourself about the thing. And then you kind of go from there. So.
Yeah, I think with any health issue, the one thing I've learned is to listen, is to quiet and listen. The amount that I've learned over the last 20 years, especially around BRCA, especially around what everyone faces, whether it's families like mine, Indigenous communities, people around the world, you just have to listen and have compassion and empathy, because at the end of the day, we're all humans, and we just need to ensure that we kind of support each other through this process, because cancer is like, I think, with COVID, cancer is the greatest pandemic of our generation, right? And the numbers that we're seeing are frightening. They're saying something like 40% of cancer diagnoses haven't occurred over the last few months around the world on average. What is it looking like in America, especially for Black communities around COVID? Not only with the rates over there, obviously in that community, higher and death rates, but the late stage diagnoses, the support that they're getting through this process as well? Because you'd be on the front lines, right, in New York, you would have seen it.
Yeah. I know currently, like if you look at the statistics across the United States, 1 in 1,000 Black people in the United States have died from COVID. That's how bad the racial disparities have been. I don't know what it is specific to New York, but that's like nationwide. Um, and I know, I don't have any stats in front of me, but I know, there's a really big push right now to really encourage women to continue to get mammograms. The sort of stats are very worrying, and they're worried they're going to see a real uptick in later stage diagnoses because people are not going to get their mammograms. But then there's also the combined problem of a lot of people have lost their health insurance during COVID, right? So it's kind of like this compounded problem of like, some people have lost healthcare coverage because in the United States, a lot of times your healthcare is tied to your employment status. Then you have the sort of people are like scared to, go to the doctor. And then you have these huge racial disparities as it relates to who is being the most impacted by COVID. And then kind of a final challenge is, in the United States, I think they're now in phase 3 clinical trials, but there's a concern that the vaccine trials are not diverse enough, right? So we don't necessarily know if when a vaccine is out, if it'll be effective across like effective across all populations. So it's a really big challenge, and it's something I think about all the time, because I think even before COVID hit in the United States, I was like, oh, right, because when you think about health inequality in the United States, it's really like a compounded problem, right? It's that minorities are concentrated in like neighborhoods that have been disinvested in, right? So like you have lower hospital quality, you have less access to like primary care, you have less access to healthy food, you have less access to exercise, right? All those things sort of compound your risk for COVID. A lot of Black workers are essential workers, which means they have to continue to go to work. They can't work from home. So when you just have all these sort of compounding inequities, I think about it a lot, and unfortunately, the U.S. response has not been great across the board, and I think that sort of just is compounded for Black community. There's like a phrase. I'm from the South originally, so people always say like when white people get a cold, Black people get the pneumonia, right? Because like things just compound more for us. So yeah. I did some stories about sort of racial disparities in COVID in the beginning, so I'm kind of like at a loss for words, because when I think about it, it's just really, devastating to think about. And then when you think about, and the last thing I'll say is, when you also think about the maternal mortality crisis, they are seeing an uptick in maternal deaths among Black women, which were already high, because particularly during the pandemic, hospitals were overwhelmed, people were very distracted. At the beginning of the pandemic, women had to give birth by themselves, like they couldn't bring their partner to the delivery room with them because of the risk of infection. And so you saw an uptick in maternal mortality outcomes. And I think I read a paper that they were predicting maybe like a 5% increase during the pandemic, sort of for all those reasons we talked about. So yeah, it's
When we talked about that, like that just makes me so sad. And I just, in Australia, we're so very fortunate. Like our numbers have been minuscule in the great scheme of things. And then we've seen, I've got a lot of family and friends in America, all across the country, and just hearing anecdotally their stories has like frightened me about the true impact of COVID. But none more than that very statistic, like 1 in 1,000. And we've seen, a lot of stories and watched 60 Minutes, and just seeing how it's affected your community has just been really heartbreaking, because it just, like, my kind of religion is humanism. I just don't understand how these things occur. So do you think free healthcare, do you think a government that implements equitable healthcare for all, will that lead to, it will lead to better outcomes? I guess look at Australia and, the free healthcare for all. Is that doable? Like putting your legal hat on? Will that ever happen in America?
Yeah, I mean, again, like this is not a stat I have in front of me, but so for people who are watching, so in the United States, we don't have universal health care. Under Obama, he did pass something called the Affordable Care Act. And as part of the Affordable Care Act, some states could choose to implement expanded coverage under Medicaid and Medicare so that more uninsured people could at least access those government programs. And actually in the states that did expand Medicaid under the ACA, you did see you saw improved outcomes across the board, but of course, particularly like improved outcomes in minority populations, right? So I definitely think, if you could implement some type of universal healthcare, like in the United States, I mean, I think you would certainly see probably like a very dramatic reduction in health disparities, just because, right? Because Black people are disproportionately uninsured in the United States. I think I would really love to see, in addition to expanding healthcare coverage, is at University of Pennsylvania, they have another really wonderful program focused on community health workers. And community health workers are professionals. I don't know if you have them in Australia, but in the United States, they're individuals who are like trained to work with disadvantaged individuals, right? And really what they do is they figure out like what the access problems are, right? So if you have a patient who is diabetic and they have challenges getting access to healthy foods, right? The community health worker works with them to figure out like, what are the actual barriers here, right? Is it that you don't have access to a car? Is it that you don't have access to a healthy neighborhood supermarket? Is it that you can't exercise, right? And they kind of just like try to tackle those problems. Is it, oh, your health is being impacted by your housing? They work to like help them find services for that, right? And then like the limited studies that they've done with community health workers in Philadelphia, right? You see really improved healthcare outcomes in minority neighborhoods, right? So, I would also, I think in addition to some type of universal healthcare coverage in the US, I'd love to see an expansion of use of community health workers in particular, neighborhoods. I also really think what you need to see too, though, is so in the US, like our neighborhoods are very segregated, right? Like, minorities, Black people tend to be concentrated in the same neighborhood. And then there's all these sort of detrimental impacts associated with segregation. And I kind of alluded to, we were talking about like hospital quality, right? So you also really need to see not just access to healthcare, but really an improvement in access to, primary care and the type of hospitals you see in minority neighborhoods. Because like in COVID in New York City, you saw dramatically different outcomes between, the community hospitals in Brooklyn, which have been historically very under-resourced, versus like the Mount Sinai's and the, right, those super well-resourced hospitals in the wider parts of the city. So I think universal healthcare is a start, and I know there's various, plans out there. I mean, one plan would be to expand Medicaid, but I think you also need those other components, right? Like you need community health workers, patient navigators. You need improved hospital access. And I also think I think too here in the US, right, is because of our insurance incentives, so many times you go to the doctor and they just can't spend a lot of time with you, right? Because the insurance doesn't incentivize them to do that, right? They're incentivized to see as many patients as possible. And I think that makes a huge difference. And I just wanted to touch on something where you're talking about how people can listen. I think another big thing is collaboration. Because someone reached out to me, a doctor reached out to me recently and asked me, how do I have conversations with my Black patients about ovarian removal if they have BRCA? Because it is the medically thing, right? It's the best medical choice. But in the US, there's a history of Black women being sterilized by the state, right? Right. And so that's a really tricky conversation. And I said to her, well, I haven't had to have that conversation yet, so I don't necessarily have advice. So I actually put out that question on my Twitter. And I said, if there's any OBGYNs who are sort of experienced in having these conversations, would love to like start a dialogue and like share information, right? And I think a consistent thing I heard from doctors were that, when I have these conversations, I don't just give a recommendation. I have a dialogue with my patients, right? And we have sustained conversations about family planning and you know, early menopause and why this is like the right medical thing, right? And so I think it's two things. It's that collaboration, because I'm like, I don't know the answers. I should find people who, right, have the answers. We should all come together. And then I think it's that like physician empathy, right? To say like, oh, how do I like bring my patient on this journey with me, right? Versus sort of dictating the answer. And so I think, I guess the final point I'll say is like, how can you make healthcare in the US better? I think it's that too, right? Like there's lots and lots of data about physician bias. You know, there's studies that, you know, doctors think Black people feel less pain, right? And so how do you also get physicians to empathize and sort of reduce that physician-patient bias interaction?
Yeah, there's such amazing people like yourself out there that it does provide that hope for the future. Like, I really feel that I'm seeing this generation of very purpose driven advocates that are quite entrepreneurial at the same time, that really are going, okay, there's problems. I'm not going to keep on talking about the problems. I'm going to go, okay, well, let's bring even smarter people into the conversation and let's learn from each other and let's collaborate and figure out solutions as opposed to just keep on talking about the problems, because I think we won't get anywhere if we just keep on going, okay, these problems are too big, we can't solve them. But I'm seeing progression everywhere around the world. It's snail pace, but I really think with leaders like you, all around the world that are all working together for the common good, that we'll get there in the end. Hopefully our generation, if not, we're doing it for the next, right? So every generation should have better outcomes. They shouldn't have worse. Thank you so much for your time. Like, you're incredible. And, you know, BRCA, I can remember when I was first told that I was BRCA, like there was only a couple of people around the world that were working in this space. One was Sue Friedman, Lindsay Abner from Bright Pink. Like, there was only a few, right? And now I'm seeing so many more openly discussing it. It makes me feel like I can kind of step back a little bit now, because there's so many people already there, like, leading the charge. So thank you. You're allowing me to be able to go off and do other things in my life, which is great. Thanks so much, Erika, for your time and for sharing all of that incredible information. Where can people find you if they want to learn more about Erika?
Yeah, so my website is my name, erikastallings.com. So you can find my writing, you can find events, you can find a link to the Barter initiative I mentioned, Black and BRCA. I also tweet a lot about health equity and racial health disparities and a whole bunch of other stuff. My Twitter handle is Quidditch424 because I really like Harry Potter.
Learn something new about everyone during these conversations. Thanks so much.